right, this is going to be a little long, so I apologize. The Department of Health and Human Services today reached out to all Medicaid providers and gave us an update on Medicaid funding and where things are going for the next fiscal year. It's not good. They have cut 3% of all reimbursement rates for all services. That's healthcare, behavioral health, long-term care, nursing home care, child care, all of it. Everything got cut by 3%. But that wasn't enough to work with the budget that was given to them by the General Assembly. So they have a $319 million budget shortfall. So many programs also had an 8% cut instead of 3%, and some programs had a 10% cut. Here are some examples of the programs that had 10% cut. Inpatient healthcare stays, outpatient hospital stays, nursing home care took a 10% cut. PRTFs, psychiatric rehabilitation treatment facilities. I really need you to know those residential facilities, I said rehabilitation is residential. Those facilities house individuals who have often cannot live on their own, have high levels of violence, and they're individuals that need high levels of supervision, medication, and support in order to be successful at all. And we cut funding to those facilities. Good call. 8% cuts to things like outpatient treatment, physician care, specialty doctors got 8% cut to their reimbursement rates as well. Cutting the reimbursement rates is going to cause problems. Not here in Wake County, where I work, and not in Durham County, where I live. It is going to cause huge problems to the rural communities and counties here in North Carolina, in places where they already didn't have enough doctors, nurses, psychiatrists, therapists, all of those things. That there already weren't enough of those people in those areas to provide services. Now those individuals will no longer be able to bill Medicaid. It is also worth noting that roughly 3 million people are on Medicaid services, and most of that is spread out throughout the state. And a lot of those people are children. Now, DHHS was smart, and they made most of the cuts to the adult programs and kept all things related to child care under Medicaid limited to that 3% cut. So shout out to them for thinking of the kids, who are a majority of Medicaid recipients. But it is important to recognize that this policy is going to close places. It's going to close clinics. It's going to close private practice doctors, or like individual doctors' offices, outpatient primary care providers. Specialty doctors who already don't really work in these communities will have no incentive to travel out there and provide services, which means that there will be a drain of these skill sets from these rural communities. They will move into the cities where they can operate under private insurance or in private pay situations. This is going to be a disaster for the farming and rural communities in this state. It is also worth noting that the same communities that will be heavily affected by this were also the ones heavily affected by Hurricane Helene. We are, by policy, abandoning those people. You cannot just get a doctor to move to your community and then offer affordable services to everyone. That's not a thing that happens. Not because of how we've set up our healthcare system. That just doesn't happen, which means that people will drive 100, 200, 300 miles to see a doctor. They'll drive to Mecklenburg County, to Wake County, to Durham County to see specialists. Imagine you have a loved one of yours that has a cancer diagnosis and they have to drive 2 hours into the city to get their treatments and then 2 hours home. How much extra burden financially that puts on you as an individual, and how much more of a burden it places on the healthcare system. Not to mention the fact that many specialties in those counties already have 6-month wait lists. I have a person that I'm connected with that has been trying to see a gastroenterologist. Every person they've called, covered by their insurance, has a 6-month waiting list for a problem they need to be seen for now. Imagine how much worse that is going to get when all these rural communities don't have treatment providers to go to of any kind and have to come into the major cities for that. I need you to know something. Your taxpayer money is paying for Medicaid. And it is paying, you are paying for somebody else's health care. It is also worth noting that your health insurance premium is also paying for somebody else's health care. That is how health insurance works. but that's besides the point. But the reason you want this money spent is because Medicaid will dictate where the needs are. They do a gap analysis every year and say, we don't have enough doctors or treatment facilities in this area. And they will provide grants and funding to send people out there. And nonprofit organizations and other healthcare entities will take advantage of those grants and go provide healthcare services where they otherwise would not, because it's not financially viable without support from taxpayer grants. Okay? That's just the way that this works when it comes to providing healthcare in our system. The system needs some overhaul, but this policy is not going to fix anything. It's going to make it worse. One of the other areas, nursing homes took a 10% reimbursement rate cut. For-profit nursing homes operate on razor-thin margins. I knew somebody once who compared it to restaurant margins. Okay? Tiny. Nonprofits also struggle to break even on a regular basis. Cutting those rates means that they're going to do one of two things. Number one, they're either just going to close outright. They're just going to shut their doors and sell the property. Number two, they're going to kick all their Medicaid clients out and refuse to take Medicaid clients and only take private pay. Fun fact, Medicare doesn't cover nursing home care. Okay? This is going to lead to elderly who are homeless that also have complicated medical conditions. It's going to fill up the hospitals. As I mentioned, rural hospitals probably will start closing or have a reduced number of beds because they won't have the providers they need to operate or the funding they need to operate. This is a disaster for rural healthcare here in North Carolina, and particularly in areas hit by Hurricane Helene. This is a foolish policy. I will illustrate how foolish it is by telling you about a problem. There was a pilot program being funded by Medicaid and DHHS under a federal grant. That program was determining how to administer Medicaid services more efficiently. And they were saving $1,000 per person per year for every recipient on that program. They were going to take their learnings from that and apply that to Medicaid as a whole, which would have saved millions of dollars per year. And they just cut the funding for that program in its entirety, and then cut funding for Medicaid services. It is also worth knowing that this current budget shortfall is not yet connected to the federal budget that passed recently. Those cuts are still also coming in 2027. Most Medicaid providers like my program and others are going to be able to navigate the waters for the next fiscal year. But in the year 2026 to 2027, you're going to see providers get cut out, quit doing Medicaid, stop taking Medicaid contracts, and you're going to see Medicaid providers shrink up. And they're all going to escape to the private healthcare system, which is more expensive. Which means healthcare as a whole is simply going to become less accessible and more expensive for everybody. I don't like to attack too many politicians when I talk about this stuff, but the reality is Republican politicians have been pushing for this kind of change for some reason I don't understand. It is bad public policy and will lead to a collapse of our rural healthcare system and overstress and overstrain the urban center healthcare systems.
Doing your work.
Thank you.
Yeah, and I was just wondering about your vote for the big beautiful bill.
Yes, it's so good.
No,
thank you.
it's I actually.
Yep, Zach, we've got a reporter. If you'd like to step in, thank you.
I would like to tell you how it impacted our family, and my son Luca.
My son Luca was born at just 25 weeks. They didn't know he was going to make it. Like, it was a 50-50 shot. He needed help. He was just this tiny little 1-pound baby that fought for his life. 4 years down the road, we are still receiving services through Medicaid as our son is autistic. And when this big, ugly bill was introduced, my heart literally dropped. So I called our senator office, Joni Ernst, and Chuck Grassley, and I never got a response out of any one of them. I would like to tell Joni Ernst face to face the impact of her vote is going to kill people. I would just like to have a conversation about why she did this.
My son was in the NICU for 141 days.
Wonderful.
Yeah, and he had
took care of him.
and Medicaid actually stepped in and we were able to afford our $1.7 million NICU bill. And now he is autistic, and we still require Medicaid.
We will take that into consideration. Should any issues come up, we will take that into consideration. Okay, so thank you very much.
Nothing, yeah.
I just spoke to Joni Ernst while I tried to speak to her about Medicaid cuts, and she cut me off. She just walked off, did not want to have a conversation with me. Yeah. Yeah, but I want to know why you think giving tax cuts to billionaires is more important than healthcare for Iowans. Please tell me.
Thank you. She already spoke with you.
She can answer.
She already said.
No, she didn't. She cut me off. When you're voting for a bill that is going to cut thousands of people off healthcare to give billionaires tax cuts, that's not what we're about here in Iowa. And it's very, very sad to see that she is not even willing to have a conversation with somebody that does not agree with her. So like I said, I'll just keep fighting for what's right here in Iowa.
Big beautiful bill, Medicaid cuts. I'm for it because I'm an able-bodied American citizen right now. I'm headed to work.
I'm seeing a lot of misconceptions about Medicaid, and I hear a lot of people saying that I don't want to pay for healthcare for people that just aren't working. So with that logic, I looked up to see roughly how many people are on Medicaid that are considered to just be not working. It's about 8% or 2.9 million people. But before you get on me, I need to say that it could be for a variety of reasons. It could be that they're in between jobs or in between school and a job. It could be that they're having a mental health crisis or some other sort of health crisis, but they're not quite qualified for disability yet. There's a bunch of different reasons. It could also just be bureaucracy type stuff. So, but let's go with this logic of that 8% of people or 2.9 million people. We are trying to cut the Medicaid budget by at least $10 billion every year. That far exceeds the amounts that these 8% of people are taking advantage of. So what else is being cut if we're cutting by at least $10 billion every year? That's right. People that you probably feel deserve to be on Medicaid. And that's why people like me are making such a stink about this and raising our voices, because we don't want for that to happen. And we want for you just to wake up and see what we're talking about. That's it.
Well, it's officially trickled down to North Carolina that Medicaid cuts are going into effect. And unfortunately, a lot of, our elderly patients are no longer going to have homes, assisted homes, where they can afford to actually live and be taken care of. This means mental health will have more people. I mean, we already got a pretty nice homeless population. I'm assuming it's going to get even worse. I think the people who are going to get the brunt of what's happening with these Medicare cuts are going to be the people in the rural areas of the state. So especially those who got hit by Hurricane Helene, which Asheville area, I mean, y'all got hit pretty bad with it.
The top 5 areas that are going to be devastated by the big beautiful bill, and these are rural counties. Kentucky. This is McConnell's home state. McConnell, he's in the Senate. This is his home state. Will be the most impacted by the big beautiful bill. Kentucky stands to lose the most rural federal Medicaid funding, $11 billion over 10 years, according to the KFF modeling score. That massive cut threatens dozens of rural hospitals already operating in the red, putting them at risk of closure. We might as well say they're going to close, okay? So that's devastating. That's the state that has the most cuts coming, Texas. And they trying to get 5 more seats to rule out the Democrats so the Republicans can stay in office. The people who voted for this big, beautiful bill want to stay in office because they know this bill, if it stands, if you guys as Republicans continue to vote for them in the midterms, they know they were going to lose their seats because they just killed a whole bunch of human beings by putting this bill into place. 69% of rural hospitals, a total of 108 facilities are projected to face reductions and loss of services. 22 hospitals in Texas are under immediate risk of closure. I'm talking about this year. Loss of Medicaid funding in Texas, combined with the already tight margins, makes it, you might as well say they're going to close and people are going to lose their lives. The gentleman before this just explained to you all what those Medicare, Medicaid, what those cuts will do, what they will do to North Carolina. Okay? Devastating cuts. Kansas City. Kansas is projected to see the most rural hospital closures of any state. 66 rural hospitals are in danger of shutting down, and 28 are in danger of the immediate shutdown within the next 6 months. This makes Kansas one of the rural areas likely to face dramatic healthcare access loss. Ain't nobody gonna be able to get to the doctor in that state. Nebraska, specifically the Curtis and the Webster counties. Curtis, Nebraska, a clinic serving at least 800 people will close this year within a month. Within a month from today. A decision that was influenced by the ongoing financial strain that they have already had and the expected Medicaid cuts under the new law. Webster County, the local hospital, clinic, nursing home in Red Cloud rely heavily on Medicaid. Cuts could turn a 5-minute trip of care into an hour and a half drive. And that delay could be life-threatening, especially if there's emergencies. What if you cut off your finger? What if you lose an eye? That's what this means. Louisiana, Appalachian, Kentucky, rural maternity services. Kentucky and California each have 13 rural obstetric units at risk, while Louisiana has 10. This is a deeper layer. Losing these services for women means pregnant women may lose their lives and the children will lose their lives. That means they have to travel even further for services if something happens. If something happens. And 9 times out of 10, something is going to happen. If you live in a rural area here and you have to drive 200 miles because the baby is in breech, or you start bleeding and you can't stop, or you go into labor and you're in pain and you're bleeding and you cannot stop, 200 miles means the difference between life and death of you and that child. This is in Louisiana, Kentucky, Nebraska, Kansas, Texas. Devastating cuts to Medicaid. This is why I said in my previous video, people are going to die.
Find somewhere else to go because they are getting rid of all Medicaid beds. And as a healthcare worker who, yes, I work for like a home health agency, but I also go to facilities. This is a little scary to me. Like, I need to find me a backup plan and find it quick.
Over 3 million North Carolinians on Medicaid. Finding a doctor is about to get harder. Starting October 1st, North Carolina will cut what it pays every Medicaid provider by at least 3% and up to 10% for hospital stays, nursing homes, and therapy sessions. Now, a 3% cut may not sound like much, but when we're dealing with a program as large as Medicaid, we're talking hundreds of millions of dollars, and this could potentially force more doctors, therapists, and clinics to stop accepting Medicaid patients altogether. Also, certain weight loss drugs like Ozempic and Wegovy will no longer be covered unless they're prescribed for diabetes or heart disease, and an early care program for kids is shutting down. This is all happening because of Trump's recent budget, aka the Big Beautiful Bill. The budget doesn't give Medicaid enough funding to keep up with rising costs. State health officials asked for $819 million. They only got $500 million, and that $319 million gap, that is now being closed through service cuts and rate reductions, which is a fancy way of saying some people are going to have a lot harder time getting the health care they need. Governor Josh Stein is urging the General Assembly to fix it, but unless the GA acts fast, and that's not something it's known for doing, these changes start in less than 2 months, and patients will feel the difference.
When President Trump signed this big, beautiful bill, it mainly referred to the tax law passed in 2017. People thought it was just going to be giving tax cuts or extending tax cuts to the rich. It gave, it gave a lot of people business, but the problem is the money had to come from somewhere. These tax cut money had to come from somewhere. The government lost a lot of revenue from those tax breaks, okay? Which meant less money left for programs that the elderly and disabled relied upon, including Medicare, Medicaid, and Social Security, right? Over time, these leaders started talking about cutting back these programs to make up for the loss and make up for those big, beautiful bill tax cuts. For the elderly and disabled people, this trickles down in a real way. Cuts or underfunding mean higher out-of-pocket costs for medicine, less support for in-home health care, fewer community resources. Someone once got help paying for their prescriptions might suddenly find that coverage is gone. Or a senior who depended on Meals for Wheels might find that program gone. These changes don't always happen all at once, okay? But those are going to be devastating to poor, elderly, and disabled. The group most affected for these cuts is the elderly and the disabled. They are the least likely able to absorb these sudden cuts and losses. A billionaire can handle a tax cut not paying for itself. A person on a fixed income cannot. What looked like a win for big corporations and wealthy families, the Republicans did this. It ended up creating pressure on the most poor and the most vulnerable. People thought, oh, let me get bum Keisha off of food stamps. Let me get bum Keisha off of Medicaid. It's not bum Keisha that is on the Medicaid. It's the disabled and the elderly and the rural communities. This means people are going to die. That's why this big bill is going to devastate all of those that I listed. Disabled, older people, veterans, the safety nets that we used to rely on for these people have been weakened, while the benefits flowed upward to the richest people in our country. The richest people got richer because of this bill, and the poorer people got poorer because of this bill.
Man, so we already have a crisis with our elderly, but now we have a bigger crisis because of the Medicaid cuts that are coming. And this hasn't taken a full effect, but businesses are preparing beforehand so they can go ahead and, just be ready to say, hey, you out of here. Let me say this to the people who don't believe. Go talk to someone who's actually dealing with the situation. Just go on TikTok. Everybody making these stories up. And it's really sad that our most vulnerable population, the elderly, the people that need it the most, the people that gave all at some point, that paid their taxes and Social Security and Medicaid costs a long time, now they're being kicked out and won't be able to be provided care. And listen up, I believe in caring for our elderly, but it's expensive to put them in a home. If you don't know, just do a little research. You're talking about $10,000 a month in some cases, and most people don't even make that. So how are they going to afford it, and how are you going to afford it to help your loved ones? These are just questions I got running through my mind. But hey, as always, I believe God will work all this out eventually in due time. But in the meantime, in between time, it's sad that these people are being kicked out of their nursing homes and facilities. Have a good day. Thanks for listening.
People defending the Medicare cuts still aren't getting it. They just live in a completely different world. I heard Dr. Oz say, just get a job. You'll feel better about yourself. Get an entry-level job or whatever, and then you'll have medical coverage. No, you won't. You won't. Those companies don't pay it. They won't allow you to work a full 40-hour week because they would be required to pay medical benefits. That's why people have 2 and 3 jobs. We have so many working poor in America. Those people on Medicare, are working if they're able, for the most part. They're disabled, they're children, or what have you. Otherwise, they're working. They're on Medicaid because their employers won't pay them a living wage. It won't work them enough hours to be obligated to pay their health care. They don't live in the world they're addressing. And
the long waits at the hospital currently are mostly from those currently on Medicaid who treat hospitals like it's a primary care office. That is true. But what do you think is going to happen when the millions of Americans who are poised to lose their Medicaid get sick and no longer have access to screenings, preventive care, and medications? Or when hospitals and nursing homes shut down because they no longer have Medicaid funding? You really don't have to be an MD to understand what's going to happen to the wait times then. Where's your critical thinking?
The nursing home that my dad is in is ending their Medicaid contracts. And he has until September 15th to figure out what to do. And so I've just been down the rabbit hole to try to figure out why would a nursing home end their Medicaid contracts? Because even though they lose money per resident, the majority of the beds are filled with Medicaid long-term patients.
Now, no hate to this creator because she actually seems like a halfway decent person. So I'm not trying to throw shade her way, but I don't know that I would describe it so much as a rabbit hole as something that should have been very apparent and evident. It's Trump's tax plan, what he calls his big, beautiful bill. It's Project 2025. They have been saying for a year now, they are going to cut Medicaid. This is not a rabbit hole. This is things that have been in front of voters and people for months and months. And this is part of the issue. This has been in front of us. And this shows that there is a lack of people paying attention. People have been told the playbook. We were told they were going to cut Medicaid. They told us a while back they had to find money and they were going to cut potentially $880 billion out of Medicaid. We knew that. And now all of a sudden people are confused as to why Medicaid is being cut and people are losing their benefits. This is not a rabbit hole. This is a shallow grave that the government has dug for us that we can look into freely because they have shown us exactly what it is. The voters as a whole just need to open their ears and open their eyes, and the truth is right in front of them.
These cuts were not accidental, okay? They were a deliberate choice to hurt the most vulnerable of our community. The Republicans did this. The idea was to shrink the government's role in healthcare and push more responsibility onto individuals and the states. Even if that meant people would lose coverage or hospitals would close, they didn't care. The Republicans did this. These Medicaid cuts tied directly into something bigger known as the Project 2025. That project is basically a playbook created by conservative groups before the election. It lays out a plan to reshape the country by slashing government programs, rolling back social safety nets, and giving more power to private businesses. Cutting Medicaid fits right into that plan. It takes more money away from programs that support everyday hardworking Americans and redirects priorities towards tax cuts and deregulations that benefit the wealthy and corporations. The problem is that while Project 2025 backers argue it will create freedom and smaller government, in reality, it devastates ordinary, everyday communities, rural communities specifically people who voted Republican. The majority of the people who are going to be hurt are in Republican states. Kentucky, Texas, Kansas, all of those states, red states, are going to be devastated the most. And most of those people voted Republican. The Republicans did this to you. Getting kicked off healthcare, Medicaid, disabled, elderly. The Republicans did this. These are not just small inconveniences that are happening. This is about a life and death access to healthcare for millions of Americans. If it continues unchecked, if we do not vote the Republicans out of office, out of leadership, The combined effect of the big, beautiful bill and Project 2025 could leave the United States with weaker healthcare, high poverty, but we're going to get more poverty. We're going to get more homeless because of this bill, and more people falling through the cracks. Mental health, veterans, children, even though most of the bill only touches on a cursory level the kids on Medicaid, but it devastates the homeless, the elderly, the disabled. This bill does. The Republicans did this. Imagine more homeless on the street because medical bills wiped out their savings. Or rural towns without hospitals where emergencies become fatal. You cut off a finger, you cut off a toe, you do any of these things because of a piece of farm equipment. You have to drive 300 miles just to get services. That's life or death. The plan doesn't just trim fat, waste, fraud, abuse. Although it wasn't that much to cut in the beginning. The fraud came from billing. People billing Medicaid for false services. That's where the fraud came from. Most people don't know that. Most people think Bum Keisha did the fraud. Bum Keisha, her lazy ass on section, her lazy ass on food stamp. It wasn't Bum Keisha. It was medical facilities billing fraudulent charges. That's where fraud was mostly at in Medicaid and Medicare. Okay, let's be clear. Most of this doesn't just trim the fat, it cuts into the bone of Americans' safety net. People are going to die. It just is what it is. People are going to die. And once that support is gone, devastating cuts are starting to happen in a month from now. It's the most vulnerable who are going to suffer in those states that I mentioned. Kansas, Texas, Kentucky, states like North Dakota. Those states are going to suffer the most. And this is what this video was all about. We need to keep our foot on the necks of the Republicans. We need to vote those people out. They are the ones who did this to our rural communities. And most of those rural communities voted for you, voted for these people who devastated their lives. It's going to affect us as well who are not on Medicaid. Why? Because our costs are going to go up. We're going to have to bring grandma to our house to live with us because we can't afford $10,000 a month in Medicaid coverage, because they're going to close beds. They're going to kick people out of housing, mental patients out of medical facilities who are violent. They're going to put all of these people in jeopardy, and we're going to bear the brunt. Us as healthy Americans are going to bear the brunt even more. Okay? This is what this video is about. Thank you for staying tuned. Please like, share, and subscribe, please.